You shouldn't cut carbs if you have type 2 diabetes. A lot of people are talking about going carnivore when you have type 2 diabetes and they're able to lose weight and lower their blood sugar. Now, of course, you will do that because you're cutting out carbs. So obviously you'll lower your blood sugar, but that is not necessarily the most sustainable thing you can do for your body. And when it comes to a healthy lifestyle, it's all about sustainability. And on top of that, you actually want to increase your body's carbohydrate tolerance if you have type 2 diabetes. Yes, you probably never heard that term before, but carbohydrate tolerance is everything when it comes to type 2 diabetes. It affects how your body processes food. So if you want to have normal blood sugar and still be able to have carbs like fruits and whole grains again, and really just reset your body to its normal range, then cutting carbs is not the way to go. Instead, you should focus on reversing insulin resistance, which is the root cause of type 2 diabetes. And insulin resistance is caused by the buildup of fatty acids inside your liver and in your muscle cells. So let's pretend that you have a lock and your cell is the lock and your insulin is key. So normally it works perfectly. However, a kid stuck some chewing gum in the lock. Does it work anymore? No, because there's chewing gum in the lock. And in this case, the chewing gum is the buildup of fatty acids inside your liver and in your muscle cells. And what you need to do is to eat more fiber and lower your saturated fat intake to completely reverse insulin resistance so that you can reverse type 2 diabetes and be able to eat carbs again and still have a great A1C. If you want to learn more on how to do this, make sure you watch my free reversing diabetes training where I break down the steps and science on how I help people do so. And I will see you in there in my link in bio.